Hello everyone. This is my design project presentation. My name is Brendan Morton, and I hope you enjoy. Product description. The description of the technology. The technology will be in the form of a phone application. And in the application, patients and doctors and other medical care providers can provide and fill out any valuable information regarding the patient's health so that other medical care providers can and the patients have knowledge and records on the medication, the procedures, and health of the patient when they have access to the technology. The question I decided to focus on and ask: does the app's ability to store data ensure that patients' personal information is secure and confidential to other medical care providers and in archives of past records? My personal answer, and in layman's terms, is yes. Now, we also have to ask, will we need an application that stores confidential data? And if it were not to be secure, like, we would obviously lose money, the trust, and most importantly, the safety of our clients would be in jeopardy. So this, of course, is not a good thing. And the point of this question about the product is to determine whether or not the goal of user confidentiality can be achieved. In the research study, Flowing in the Wind, there is a statement that relates to my product description's main purpose. In the article, it is stated, Moen and Brennan outline common strategies for managing health information in the home, distinguished by information visibility and importance. The main type of technological support for PHIM activities has been the personal health record (PHRs). These tools, usually web-based, enable patients to have a single location for their medical history, lab results, medications, and immunizations, and often connect to hospital records. Now, one difference obviously that should be noted is it is not explained as a phone application here. However, the reason I bring this up is because we now have evidence that this idea is already relevant today in the real world, so which relates to the HCI and social cultural points to my proposed product description. On an important side note though, can we know that this is okay to use in the ongoing future, or is this another example of user invasion of privacy, kind of like how current day Facebook operates? We now we may just choose to accept this if it becomes a norm in everyday lives, as the benefit in technology can overrule the danger levels of human confidentiality being threatened. Now, I think this is a great example of a social technical and social cultural acceptance in an HCI developmental area. Another point that was brought up in the research study, Blowing in the Wind, is, and I quote, diminished attention also made it difficult for participants to accurately understand and remember the information that physicians presented during appointments. Unless they immediately captured this information, many of these issues they discussed were soon forgotten. Now I'm going to actually further dig into this and also kind of like, you know, kind of dig for more details and also give you a kind of glimpse of what I'm thinking they're kind of leading this onto. Um, I think that this brings awareness that we are too reliant on the technology so we can forget what we used to know about our past and present personal information. So instead, what we should know about ourselves is now more so stored and aware on a computer or phone application. As a result, well, the computer and the phone application are more aware of us than we are of ourselves. The study's findings. So there are a few relevances that are between the study findings and the proposed product I chose, and they're in the HCI realm, in the social technical and the social cultural adaptations. The study's findings and how they apply to the proposed product have a very similar uh, traits and ideas and concerns surrounding both of them. One such finding, and in the article I quote here, one such finding of the study was, for example, Ballagard argues that healthcare systems are traditionally designed from a clinical perspective, which focuses solely on what the technology needs to do to improve the patient's health. With this, they contrast their citizens' perspective, which pays close attention to the personal goals of patients and how technology fits within the context of their daily lives. Um, so this is a clear example that relates to my product's functions, and moreover, how we can foresee the socio technicalities that this can bring to our everyday lives. So in conclusion, revisiting the question, does the app's ability to store data ensure that patients' personal information is secure and confidential to other medical care providers in archives of past records? Does it provide us the answer we asked and what we were looking for? Technically, yes. The reason why it can be secure is because, well, the proposed product will essentially be unusable and pointless if it only operates with negative outcomes, especially an outcome that threatens human privacy and personal confidentiality. So, in conclusion, I guess that yes, the goal can be achieved and can be beneficial to medical care providers and to the patients as well due to the convenience, the accuracy, and the overall positive benefits that could come forth with this design product. That is the end of my presentation, and I do hope you enjoyed and learned something new. I thank you for listening. Take care. Bye.